Hi, my name is Barry, Barry Roper, and I'm currently the officer responsible for surveillance and emergency response unit of the National Health Department of Health. And this unit was established in 2009 and 10 National Health Department restructure, which the surveillance unit was established. I'm now also acting manager for disease control programs between TB, HIV, malaria, non-communicable disease, and surveillance in measures. So five units in this control section. And also, I'm the focal person for international health regulations for PNG. So that's mouthful, but that's what I'm doing at currently. Yeah. It goes way back 2015, 13 when I started attending some international meetings, and I was introduced to the field aviation training program in some countries in the Western Pacific region, but also global. And um, my WHO counterpart started introducing to say this is a good program. And in 2012 and 11, which I was part of the team that we went and undertook the 3 months FET training program in India, and I saw that this training was very good. It really helps people to upskill their knowledge and skills on basic field epidemiology, but more importantly, I do a little bit of more operation research, utilization of the information, and presenting the information. So I thought to myself, this is going to be great. So after 2012, then came back and got a support from WHO, and we started training program in 2013. And I think we've now had uh, seventh court in 2019, and we were supposed to have a 2019, and the eighth court supposed to start 2020, but unfortunately, COVID came, so the intermediates in hold, but we have advanced FETP program, which we have recruited 29 out of the 96 graduates, and though there's some disturbances in that area in terms of the continuation support to the advanced, but we're working on to make sure that we graduate our advanced FET training program. So far, so good. I mean, I never expected this, but with the results and the outcome and the reports that we're getting, and then also me being out in the field and seeing what our FET grads are doing, I've been impressed with it, and I'm happy to continue this training program because there's more demand. There's the people are seeing the result of this, especially trained people out in the field who are doing a great job, and I think we have become more visible in this COVID time, where these graduates are doing a great job in terms of leading in the incident management system at the provincial level, also at the national level, at the NCC, the National Coordinating Center, and I think we're getting positive feedback from the province and the administrators and the co-workers, and they're doing a great job. Not all 100%, doing great job as we expect, but I think there's room for improvement, and we have planned to continue to support them, upskilling their leadership and improving the area of work. So, for me, I think I'm impressed. I'm a quite achiever and I like to continue this training program as long as I'm in a department. They were actually really good, at a time, and also we had an opportunity to try mobilizing FET graduates from other provinces to go and support, other provinces. We did try that, and we will see how we can. In this COVID, we couldn't do that because every province was, affected, and they need to prepare for, COVID, preparedness and respond in their own provinces. But I think we had, experience trying to mobilize our own resource, having FET grads go and assist in other provinces, and that's one of the positive developments, and we want to build on that. And this, I think, the rapid response team that we have started, which we have completed 6 provinces, may also be able to strengthen that capacity to not only to be team leaders and a team in their own province, but we can deploy people from other province to another province to assist. So, I think they're doing a big, impact is, it's huge. We need to do, a lot of work in terms of getting information from each of the provinces where our FET graduates are. But, from what we're hearing, that they've made a lot of impact in terms of collecting information, analyzing information, presenting to the management of how they can understand better and interpret the information to the management. That's what we want them to do. And also, I think they have been, team leaders in terms of gathering information, also feeding the information down and also up. So that's a big turnaround, from where we were before the training and now. So, but a lot of improvement to be done. But I think there's certainly a visible, improvement in terms of how the information is collected, the quality of the data and analysis that we is sent through the system, and how the feedback is given to the management in their own respective provinces. So that's that good feedback we're getting here. Yeah. At first, I was like thinking, okay, this is for improving surveillance, for outbreak response, but I think it's more than that. I see more than it's probably building capacity to, analyze and know what I do with the programs, not in surveillance, but in all disease control programs, in all public health programs, and first we targeted only, the disease control officers and surveillance officers. Now we're getting program managers, program officers, and even we've got on laboratory officers and infection control officers, health information officers. We train them, and the demand is growing, and I kind of feel that, now that I've started, I need to keep on going, but the only thing now is like I need support, I need resources. I think in terms of finance and resources are out there, when we reach out to the global community like WHO and DFET and CDC, and those have been our major partners, but there are more people out there. And when we are putting the results out, I think there's people want to give assist us, but then we need capacity at the national level, we need capacity at the province level, because the actions has to happen at the province. Though we are trained in people FETs, we need people to coordinate and manage what happens in the province, and then we have to provide that support from the national level. At the moment, I think that's where the issue is now. Yeah. Yes, and also to probably coordinate those FET grads that we have in the districts and health centers, because our hope is that our plan initially was to have 2 in each provincial level and 1 at the district level. I think that I think with 96 graduates, we probably have met the target somehow, but some districts still don't have 1. But if you go by province, say 3 in each province, we probably already have met. And some provinces got more than 3, but I think that we have covered it. But now we need to make sure that every district where there's no FET grad, should have FET grad. And as a training director and coordinator, that's my aim, that we need to keep the balance of making sure that every district is covered. Of course, there's always a tendency of good people have been promoted and taken out from the district level where we want to make them stay, but it's good for the good for the training. So we have people going up the rank and file with the knowledge and skills of feel happy, and they can make the correct and right decisions, support the training, and support the officers while they are working in the field, in the area of surveillance and reporting and response, and also making decisions for public health programs and clinical management at the lower levels. Yeah. I 99%, I think, because our target is to train people who are existing in the system. Not we haven't opened up our doors for people not in the system. Though there are a great big interest even from private sectors and private medical service providers. Yes, we've taken one or two people here and there, but I think our focus is to train people already working in the system, so that once they finish the training, they remain in the system, and they help us to meet our desire, our aim is to improve surveillance and response and reporting and data management and making decisions. Demand has been growing every year. Um, demand is huge now. One province want to have training, but we go in by equal distribution, making sure that where we must an FET graduate, high priorities, the disease control officer, if there's surveillance officer, and in each district level, the OIC or the clinical person, and then we also got the other people that we have targeted is health information officers and infection prevention and laboratory. So the demand is big, but because of our capacity, and also we want to have a quality trained people and to match with the number of faculty members we have been limiting ourselves to, in the past couple of years, was up to 18. Then we reduced down to 15, and maybe starting from after COVID, maybe next year, we probably even to reduce down, so that what we want to do is to produce quality and have our faculty members to have good support. Maybe our numbers will reduce, but it's not, that will change from time to time, depending on our capacity and the need out there. Yeah. I've seen the results, and the demand is growing. There are people who are getting promoted because of FET graduate, and those are achievements of its own, and that I know that I had a reason to continue this training. So because I see that there's a the result of hard work, I think. So it's probably one of the best things I've done in my work life, I guess, apart from maybe achievements of my life has been getting PNG certified for polio in 2000. I was the lead person in the country's process of the certification process, which I have a medal from Queen Elizabeth for doing that. And then the second thing I'm most proud of was, before FETP, was getting a unit established in the department, that is Surveillance and Emergency Response Unit. There was never a Surveillance and Emergency Response Unit, and a fully pledged 9 positions, which currently 3 of them occupy, which include myself, and we've got 6 positions vacant. And the third most important I think I've achieved so far in my life, in the history of my work life, is FETP. And that's truly hard, that's probably the best thing, yeah, because I can see the result of it. And there's improvement in surveillance reporting, but also most importantly the number of referrals that I used to get in terms of health events in the province has reduced dramatically, in terms of provinces going out and doing the investigation, respond, not verify and respond to any events. For me, I don't have the numbers, and because how many, but I can say that it has reduced dramatically, which means that was the purpose, for people to manage health issues when reported. So yeah, those are 3 most important things in my life, in my work life. But this is the current and recent one, and that's probably the one will keep me going until maybe if it says I'm going to go, then I will have a training program running to, to support the country and improve surveillance and emergency response units. So that's, yeah.
Great. Thanks, Barry.
Thank-